Hello everybody, welcome back. Today we will talk about generalized cyanosis. Cyanosis is the bluish color of the skin and mucosal surfaces. Cyanosis disappears with digital pressure. Cyanosis is not the same as false cyanosis. So how can we differentiate between cyanosis and false cyanosis? Cyanosis disappears with digital pressure, as when compared to false cyanosis does not disappear with digital pressure. So what is false cyanosis? Is the discoloration of the skin induced by the deposition of gold salts, silver salts, or arsenic or other compounds. What can cause or lead to cyanosis? Cyanosis can be due to 1. An abnormal hemoglobin or a rare type of hemoglobin like Kansas hemoglobin, methemoglobin, or sulfurated hemoglobin. The second cause of cyanosis can be due to an increased quantity of reduced hemoglobin in the arterial blood. Cyanosis can be localized or generalized. The generalized cyanosis can be central or peripheral. Central cyanosis include pulmonary central cyanosis and central cyanosis with right to left shunt. As for the peripheral generalized cyanosis, an example is cardiac stasis cyanosis. So let's talk about the central generalized cyanosis. We said examples are pulmonary central cyanosis and cyanosis which is central with right to left shunt. We'll start talking about pulmonary central cyanosis. Pulmonary central cyanosis is the sign of respiratory insufficiency. There is a bad oxygenation of arterial blood in the lungs, meaning a low arterial saturation. Pulmonary central cyanosis is caused by 1. A low alveolar oxygen pressure, 2. Disturbances in gas exchange, 3. Ventilation perfusion mismatch. So let's talk about the characteristics of pulmonary central cyanosis. The characteristics include 1. A generalized cyanosis, even the tongue is cyanotic. 2. The patient's temperature is warm. Hypoxia induces vasodilation. 3. A Lewis test, which is negative. Rubbing the earlobe with the fingertips does not make cyanosis to disappear. Note, oxygen supplementation of the inspired air may correct cyanosis in the case of pulmonary central cyanosis. So what is central cyanosis with right to left shunt? Central cyanosis with right to left shunt is also called the blue syndrome. The causes of central cyanosis with right to left shunt include 1. Congenital heart disease with right to left shunt. Central cyanosis with right to left shunt is associated with 1. A retarded growth and physical development. 2. Dyspnea on exertion. 3. Clubbing of the fingers and toes. 4. Note that the central cyanosis patient position is the squatting position. Note it is not influenced by oxygen administration. So it is important to note that central cyanosis with right to left shunt is not influenced by the oxygen administration, as when compared to pulmonary central cyanosis is influenced or can be influenced by the oxygen supplementation. What about peripheral cyanosis, stasis? This central generalized peripheral cyanosis is the sign of right heart failure. This type of generalized peripheral cyanosis is accompanied by gravitational edema. What are the characteristics of peripheral cyanosis? 1. It respects the blood peripheral circuits. 2. It doesn't affect the tongue. 3. The patient temperature is cold because of the low velocity of the blood. This type of peripheral cyanosis, the Lewis test is positive. Rubbing the ear lobe with the fingertips makes cyanosis to disappear, becoming red. In cardiogenic shock, patients presents a pale cyanosis due to vasoconstriction, marmoreal tegments, which remain cold and cyanotic when adopting a declive position. Thank you for watching and looking forward to see you in the next video with a new topic.